part of the occupational English test has 3 parts, and in each part you hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you hear 2 different extracts. In each extract, a health professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a doctor talking to a patient called Tainatongo. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello, doctor. Good morning. Good morning. What's your problem? Well, doctor, I have intolerance to allergies, inhalant and environmental allergies. What's your age? 36. Okay, do you get any kind of reactions like an itchy rash, throat or tongue swelling, shortness of breath, vomiting, lightheadedness, and low blood pressure? Clinically, these symptoms show the presence of anaphylaxis. No, doctor. Or else, do you get itchy red welts called angioedema that develop on your skin? No, doctor. Are you taking any medication for allergies? No, doctor. May I know your past medical history? 6 months back, when I was under dialysis due to renal failure, I had an acute event of perioral swelling, etiology uncertain. The diagnosis results showed that the allergic reaction was due to Keflex that was used to treat a cellulitis dialysis shunt infection. What medications are you taking now? I am taking atenolol for controlling my blood pressure, sodium bicarbonate, Lovatsa, and Dialovite. I didn't have any other issues upon my treatment and discharge. That included corticosteroid therapy and antihistamine therapy and monitoring. What were the surgeries performed? Permcath insertion 3 times and peritoneal dialysis. Are you allergic to any medications? Yes, heparin causes thrombocytopenia. Do you drink or smoke? No, doctor. May I know your family history of diseases? My family members have severe heart disease, carcinoma, and food allergies. Well, your test report shows your blood pressure is 128/78, pulse 70, temperature is 97.8, weight is 207 pounds, and height is 5 feet 7 inches. I suspect you have developed acute anaphylaxis. I would suggest you to go for a radioallergosorbin test, a blood test using radioimmunoassay test to investigate specific IgE antibodies to determine the substances the subject is allergic to. I shall recommend further treatment and medications upon the test results. If the test report shows any specific food or inhalant allergen that is found to be quite high on the sensitivity scale, I would likely recommend that you avoid the offending agent. Right now, I would recommend you to stop further usage of cephalosporin antibiotics, which may be the cause of your allergic reaction, and I would consider your case as an allergy. Being on atenolol, it would be very difficult to treat acute anaphylaxis. I am prescribing an EpiPen in the event of acute angioedema or allergic reaction or sensation of impeding allergic reaction, and you have to proceed directly to the emergency room for further evaluation and treatment recommendations after the administration of an EpiPen. Extract 2. questions 13 to 24. You hear a physician talking to a patient called Ndamukong. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello, doctor. Good morning. Good morning. Please be seated. May I know your problem? Well, doctor, I have multiple issues with my teeth due to severe dental disease. I have had many of my teeth removed. Now I have severe tooth pain. Both lower and upper teeth on my left side have been troubling me for the past 3 days. Well, what's your age? 29, doctor. What medications are you taking? I'm taking OxyContin and Vicodin for my knee pain. I need more pain medications because I do not want to use that medicine for my toothache. Are you allergic to any medicine? Yes, penicillin and codeine. Do you drink or smoke? I do not drink, but I do smoke regularly. Well, your test reports show temperature 97.9, blood pressure is 146/83, pulse is 74, respiration 16, oxygen saturation 98% on room air, and interpreted as normal. Mouth and oropharynx shows multiple denture and multiple dental caries. You have tenderness to tooth 12 as well as tooth 21. Your gums are normal. There is no erythema or swelling. There is no purulent or other discharge noted. The floor of your mouth is normal without any abscess, suggestion of Ludwig's syndrome. You have developed odontologia and multiple dental caries. Well, I am prescribing Dilaudid of 4 milligrams intramuscular, and I would suggest you go for a filling. In this treatment, the affected area of the teeth will be drilled, and the decayed substance will be removed, and the empty space will be packed with an appropriate dental filling material. Okay, doctor. Thank you.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now, look at question 25. You hear a discussion between a doctor and a nurse about spastic cerebral palsy and its classifications. Hello, doctor. What is spastic cerebral palsy and how is it classified?
Well, spastic cerebral palsy is the common type of cerebral palsy that also accompanies nearly a third of other types of cerebral palsy. The damage is in the corticospinal tract or the motor cortex. This part affects the areas that receive gamma-aminobutyric acid that is an inhibitory neurotransmitter. Spastic cerebral palsy is further divided into types according to the areas of the body that it affects. In spastic diplegia, the lower limbs are affected with little to no upper body spasticity. Most people with spastic diplegia are fully ambulatory and have a scissors gait. They may also have other problems like hip problems, dislocations, crossed eyes, or strabismus. In spastic hemiplegia, one side of the body is affected, which occurs when injury occurs to muscle nerves controlled by the left side of the brain, will cause a right body deficit, and when injury occurs to muscle nerves controlled by the right side of brain, will cause a left body deficit, vice versa. In spastic tetraplegia, all four limbs affected equally. These patients are least likely to be able to walk because their muscles are too tight, and they may also develop an uncontrollable shaking that affects the limbs on one side of the body that impairs normal movement.
Question 26. You hear a discussion about different dose rates of brachytherapy.
Hello, doctor. What are different dose rates of brachytherapy?
Well, brachytherapy is a form of localized radiation therapy involving the direct placement of radioactive material close to or inside a tumor. Brachytherapy varies by dose, mode of delivery, and the location of the cancer. High-dose rate brachytherapy is given over periods of 10 to 20 minutes. The radiation dose is delivered as a short burst using a remote after loading machine. Low-dose rate brachytherapy is administered at a continuous rate in sessions that can last up to 50 hours. In the pulsed dose rate brachytherapy, the radiation is usually delivered once every hour rather than continuously. Question 27. You hear a discussion between a doctor and a nurse about bariatric surgery. Hello, doctor. What are the different types of bariatric surgery?
Well, there are 4 different types of surgeries offered to patients. The main principle of adjustable gastric banding is to decrease food intake with the use of a small bracelet-like band placed around the top of the stomach. The band restricts the size of the opening from the throat to the stomach, limiting the amount of food a patient can ingest. The size of the opening can be modified using a balloon inside the band that can be inflated or deflated with saline solution according to the needs of the patient. Biliopancreatic diversion with the duodenal switch, also known as the duodenal switch, is a 3-stage procedure that involves the removal of a large part of the stomach, which makes the patient feel full after eating only a small meal, followed by rerouting of the small intestines to prevent food absorption. The third step involves changing how bile and other digestive juices affect the process of digesting and absorbing calories. Roux-en-Y gastric bypass method is also used to decrease food intake and involves creating a small pouch. The food bypasses the rest of the stomach and reaches the small intestine, where it is absorbed to a much lesser degree than if it had passed through the stomach, duodenum, and upper intestine. Vertical sleeve gastrectomy procedure involves removal of most of the stomach, which not only restricts food intake and absorption, but lowers the levels of the hormone ghrelin that is responsible for appetite.
Question 28. You hear a discussion about oral lichen planus lesions.
Hello, doctor. What are the different types of oral lichen planus lesions?
Well, oral lichen planus lesions may belong to one of the following 6 types. Reticular is the common and usually asymptomatic that presents with a fine network of white lines called Wickham's striae, which are symmetrical and found on both sides of the mouth, usually over the buccal mucous membrane. Erosive consists of irregular painful ulcers covered by a yellowish pseudomembrane of fibrin, with the white striae all around the lesions. Atrophic is usually found as an ulcer covered by fibrinous exudate on an erythematous background. Bullous is the rarest type that is characterized by small or large vesicles, or bulli, which break open, leaving a painful ulcer. Papular is an uncommon type, consisting of tiny raised white spots with the characteristic white striae at the periphery. The plaque lesions appear as smooth to slightly roughened whitish patches, rather like leukoplakia, found over the tongue and the inside of the cheeks. Question 29. You hear a lecture about the autoimmune diseases that affect the blood and blood vessels. What are the autoimmune diseases that affect the blood and blood vessels?
Well, polyarteritis nodosa is a severe autoimmune disease affecting the small and medium-sized arteries that become inflamed and damaged. Idiopathic thrombocytopenic purpura causes damage to the blood platelets that are essential to formation of blood clots. Antiphospholipid antibody syndrome leading to damage to blood vessels. Hemolytic anemia is caused when the immunological cells damage the blood cells.
Question 30. You hear a discussion about different types of biosensing elements. Hello, doctor. What are biosensing elements?
Well, an enzyme is a protein that has a high selectivity for a particular substrate, which it binds to, bringing about a catalytic change. Enzymes are commercially available in highly purified states and are therefore useful in the mass production of enzyme sensors. Enzymes can be fixed onto the surface of a transducer through absorption, covalent attachment, and entrapment in a gel or an electrochemically generated polymer. Antibodies, or immunosensors, are produced by B lymphocytes in response to antigenic stimuli such as foreign invaders or microbes. When used as biosensors in immunoassays, antibodies are immobilized on the surface of a transducer through covalent attachment by conjugation of amino, carboxyl, aldehyde, or sulfhydryl groups. Antibodies are sensitive to changes in potential hydrogen, ionic strength, chemical inhibitors, and temperature. Immune sensors usually employ optical, fluorescence, or acoustic transducers. Microorganisms or microbes may be used to detect the consumption of oxygen or carbon dioxide in an environment using electrochemical techniques. Microbiosensors have the advantage of being cheaper than enzymes or antibodies and are more stable. However, they may be less selective than enzymes or antibodies.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the best answer, A, B, or C, which fits best according to what you hear. Complete the answers as you listen to the audio. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear the lecture given by a physician on the topic of cystic hygromas. You have 90 seconds to read the questions 31 to 36. Cystic hygromas are fluid-filled sacs that commonly occur on the neck or head of a baby as a result of blockages in the lymphatic system. At times, cystic hygromas are detected through ultrasounds during pregnancy. Some cystic hygromas may not appear until the child grows. Cystic hygromas affect 1 in 800 pregnancies and 1 in 8,000 live births. In 80% of cases, cystic hygromas appear on the face, including the neck, head, cheek, mouth, or tongue. It can usually grow in other parts of the body, including the chest, armpits, buttocks, legs, and groin. Usually, cystic hygromas that are present at birth or develop after birth are benign. However, they can be disfiguring, grow very large, and affect a child's ability to swallow and breathe. At times, cystic hygromas detected during pregnancy go away before birth. A fetal cystic hygroma can be a risk factor for miscarriage. Although usually cystic hygromas affect children, there are rare cases of their appearance in adults. In a remarkable case, a 32-year-old man had a cystic hygroma on his neck that appeared 8 months before diagnosis. He was experiencing severe pain and swelling in the right lower part of his face that extended to his neck. Biopsy confirmed it was an adult-onset cystic hygroma. Environmental and genetic factors caused the formation of cystic hygromas. Mainly viral infections transmitted to a fetus during pregnancy or drug and alcohol consumption during pregnancy are the causes for cystic hygroma formation. However, most of the cystic hygromas are due to genetic conditions, especially due to chromosomal abnormalities accounted for in 50% of the cases. Genetic causes for cystic hygroma are: Turner syndrome is a condition where a woman is partially or completely missing an X chromosome, causing change in appearance and problems related to the fertility and heart. Patients with Noonan syndrome may have unusual facial features, bleeding problems, heart issues, short stature, skeletal abnormalities, and many other symptoms. Trisomy 13, 18, or 21. These conditions cause the embryo to develop an additional set of chromosomes that produce a variety of congenital abnormalities, including intellectual disability. Depending on the location of the cysts, the symptoms of a cystic hygroma may vary. Some children may not even experience any symptoms other than its growth. The most common method of diagnosing cystic hygromas is ultrasound imaging. Usually, cystic hygromas are diagnosed when the fetus is still in the womb during a routine abdominal ultrasound. It is also detected in a blood test carried out at 15 to 20 weeks. If the blood test result shows high levels of alpha-fetoproteins, it might be an indication of cystic hygroma. Although ultrasound images may indicate the possible location and size of a cystic hygroma, additional diagnosis may be required for obtaining more information, such as depth and severity of the growth, and any obstructions that can indicate a breathing problem. A transvaginal probe method can take better images of the cystic hygroma without the obstruction of other organs in the way. fast-spin magnetic resonance imaging can provide a clear image and more details about the cystic hygroma. During amniocentesis test, a doctor will collect amniotic fluid through a special needle for testing chromosomal abnormalities. Normally, there is no need for any treatment for a cystic hygroma, as long as it is not causing any health issues. Sclerotherapy is one treatment option, in which a specialist injects a chemotherapeutic agent called bleomycin into the cystic hygroma to shrink its growth. However, it may take several therapy sessions for this to happen. Moreover, a cystic hygroma can also grow back. A surgical removal of cystic hygroma may be considered only when the child grows a bit older. However, surgery can cause significant scarring and complications such as damage to nerves, arteries, blood vessels, and structures near the cystic hygroma. In case the cystic hygromas have associations with other genetic conditions that may impact the development of the child, cystic hygromas can grow back even after surgery, treatment, especially if the cyst cannot be removed completely during the pregnancy. Now look at Extract 2, questions 37 to 42. You hear the monologue of a physician giving a lecture on delusions of grandeur and its treatments. You have 90 seconds to read questions 37 through 42. Well, a delusion of grandeur is an unusual or false belief about one's greatness. For instance, a person with this condition may believe that he is famous, can end world wars, or that they can be immortal. Delusions of grandeur, also known as grandiose delusions, often accompany other mental health symptoms. They may be linked to physical or mental health conditions, such as schizophrenia, bipolar disorder, or certain types of dementia. The condition may be persistent, or it may appear only periodically. Certain people with delusions of grandeur also experience other delusions, like an unusual religious belief or a fear of persecution. However, a delusion of grandeur is more than just very high self-esteem or an inflated sense of self-importance. It marks a remarkable detachment from the practical world. A person with this condition may continue to believe in his delusion despite contradictory evidence. Delusions of grandeur come in many forms. Many people experience a similar theme over time. Schizophrenia is a mental health condition that causes delusions, hallucinations, and false beliefs. Bipolar is a mental condition classified by periods of depression, followed by periods of mania. During times of mania, a patient may have a highly inflated sense of self, which can manifest as a delusion of grandeur. During a manic episode, a person with bipolar may tend to spend too much money, have trouble sleeping, appear very hyper, or behave aggressively. Narcissistic personality disorder. In most mental conditions, patients with the similar condition can have very different personalities. Personality disorders directly affect the personality, fundamentally altering how a person relates to others and themselves. People with narcissistic personality disorder have a very high inflated sense of their own importance. They seek flattery and validation, believe themselves to be extraordinary and unique, and lack empathy. A person with narcissistic personality disorder may have a sense of entitlement that leads them to act in ways in order to obtain admiration and special privileges that is objectionable to others. Most people consider dementia, including Alzheimer, a memory impairment, yet dementia slowly reduces a person's ability to think clearly. It can affect the way we interact with the world, plan, and think. As dementia progresses, some patients develop delusions, including delusions of grandeur. Dementia patients with delusions of grandeur typically have many other symptoms, including significant memory issues. Damage or injury to the brain can also change the way people think at times, potentially causing delusions. Brain injuries may also cause hallucinations, personality changes, memory problems, and difficulties with basic skills, such as reading. Attending group therapy may help the patient to build healthier relationships with others. Treatment for delusions of grandeur is very difficult, since the patients may feel these delusions are good to them and truly believe in their delusions. They often resist treatments. Often, antipsychotic drugs are helpful in treating delusions due to many causes. Patients with bipolar may need to take drugs such as lithium or other mood stabilizers. Patients with delusions related to personality disorders may require comprehensive ongoing therapy to offset the effects that delusions have had on their personality. Often, the treatments for delusions of grandeur will focus on managing and reducing symptoms rather than curing the underlying condition. Depending on the cause, the patient with delusions may need to take medication or have long-term therapy to cope up with their symptoms throughout their lives. Helping a patient to understand how their delusions have a negative impact in their life or relationships, along with support and treatment, the patients with delusions can lead a peaceful life. That is the end of Part C. You now have 2 minutes to check your answers. This is the end of this listening test.